Welcome to week 32. Your baby is now about 3.5 pounds, about 18 inches long. Of course, continues to grow, almost half the weight you would expect at birth, still a little bit under that, so there's still a lot of growing to do. But at 32 weeks, you've got a nice sized baby, and the good news is you can kind of take a deep breath and relax a little bit at 32 weeks. If you have your baby now at 32 weeks in a hospital that has a good NICU, your baby's going to have to be in the hospital for a while, but ultimately you have an excellent chance of having a totally normal baby when all is said and done. And in fact, in hospitals with very good NICUs, statistics say that babies born at 32 weeks, if you look at them, say when they're kindergartners, are indistinguishable, do just as well as babies born at term. So you certainly don't want to have your baby at 32 weeks, but if you do have your baby at 32 weeks and you have a good NICU, a good neonatal intensive care unit, your baby's going to be just fine. It's going to be challenging. There's going to be a month or so when the baby's in the hospital, but your baby is probably going to be okay. So it's kind of time to take a deep breath. You sort of made it. Now we want the gravy and we want you to get farther, but 32 weeks is a nice sort of turning point. The other thing at 32 weeks is this is what I call the 32-week wall. This is sort of when pregnancy is not so much fun anymore. The baby's getting heavier, you're starting to have more Braxton Hicks contractions, everything's harder. It's hard to sleep, it's hard to walk, your hips start to hurt, your feet might hurt, and it's just a bit tougher at 32 weeks. And this is sort of when, kind of the miseries of pregnancy, the aches and pains start to come on more. But that's a good sign because it means you're down the home stretch here and you're heading for home, and it won't be long until you're holding that baby of yours. The other thing at 32 weeks is that often now the baby's head will be down, it'll be pointed down in what we call the vertex position. Now, don't worry if it's not. The vast majority of babies that are not head down at 32 weeks will be head down by the time you deliver. And in fact, whatever you do, don't spend a bunch of money on some kind of thing that's going to make your baby turn if it's not head down at 32 weeks. Probably 95% of babies that aren't vertex head down at 32 weeks will be by the time you deliver. So don't worry if it's not. But oftentimes this is sort of when it starts finding that position of head down. And the nice thing is the baby fits best head down. And so once you have that head down position, the baby usually won't give it up. So generally at this point, once the baby's vertex, its head is down, it generally, not always, but generally will stay that way. So 32 weeks, baby's 3.5 pounds, about 18 inches long, and doing well.